There's so much to see here. So much work has already been done. Building momentum to create more of this quality of life. In a world with less communicable diseases, more people have the chance to build better, healthier, safer lives. But the momentum cannot stop here. The COVID-19 pandemic has shown us that as long as communicable diseases continue to spread, the quality of our lives is at stake. We are all at risk until everyone is safe. That's why PAHO's Elimination Initiative has set its sights on eliminating more than 30 communicable diseases and related conditions by 2030. To achieve this, we must ensure everyone in the Americas has access to vaccinations, quality health care that includes timely diagnosis and treatment, as well as water, sanitation, and hygiene facilities. This is not a dream. It's a right and everyone's responsibility. We should all have an equal opportunity to enjoy healthy, impactful lives. There's so much more to see here. So let's work together for a disease-free future for all.
It is a special honor to welcome to this virtual forum key actors supporting this malaria elimination effort in the community, especially the community agents, among others the volunteer collaborators that we have throughout the region. My warmest welcome is extended to all, either joining online through Zoom or following the event live on the PAHO TV YouTube channel. Before going into business, please consider with me some housekeeping pieces. Translation is available into English, Spanish, Portuguese, and French on your Zoom. Please click on the glove icon and select your language of preference. Everyone will be put on mute by default, and the organizers will help facilitating the mic's opening when required for comments. Ladies and gentlemen, welcome to the 18th annual celebration of Malaria Day in the Americas, as well as the recognition of our Malaria Champions of the Americas 2024. We will open the session with a video from Dr. Jarbas Barbosa, Director of the Pan American Health Organization.
El año pasado, 2023, se registraron 500,000 casos de malaria.
Last year, in 2023, 500,000 cases of malaria were recorded in the region, which presupposes a 5% increase of malaria in the region. Malaria continues to affect people affected by mining and other areas. It is possible to eliminate this disease from our region. That's the good news. Celebrating the Day of Malaria of the Americas, we appeal to member states and interested associates, including the affected communities, to intensify their efforts aimed at eliminating malaria regionally, to join efforts to diagnose and treat this disease. The health services, where there is endemic malaria and our affected communities, could be part of the solution. The collective partnership between the states and the main stakeholders to make malaria treatment available to the population without barriers everywhere. I think together we can eliminate malaria from the Americas.
Muchas gracias por el mensaje al Dr. Barbosa.
Thank you very much for that message, Dr. Barbosa. Now I would like to call on Ms. Gabrielle Hunter, Technical Assistant at Johns Hopkins Technical Communications Program, for remarks on the behalf of the Malaria Champions Committee. Go ahead, Gabrielle. Thank you, Patty. I'll make my comments in English.
It is my honor to provide some opening remarks for this commemoration on behalf of the Malaria Champions of the Americas Committee. My name is Gabrielle Hunter, and I, through my organization, have been a long-standing member of this committee for several years. Malaria Day in the Americas is an important day to reflect on the region's progress against malaria, celebrate the successes, and also highlight the challenges and what remains to be done. Looking at the data, in 2023, there were a reported 505,000 malaria cases in the Americas. This represents the 5% increase from 2022. The region remains far from reaching the target we had previously set for ourselves of no more than 120,000 malaria cases annually by 2025. This is a difficult reality, and we must face it. Malaria cases in the region primarily are being driven by some of the high-burden countries, such as Brazil, Colombia, Venezuela, with indigenous and gold mining populations being some of the most affected, and population migration also being a really important driving factor. On the other hand, Suriname has had no autochthonous transmission for 3 consecutive years, and Ecuador and Honduras show decline. Mexico, Dominican Republic, Costa Rica, Guatemala, French Guiana are all on track for elimination. So from this, it's important to remind ourselves that we know it is possible to achieve the goal of elimination, even in the face of setbacks. The Malaria Champions Committee, collectively, we applaud PAHO for maintaining an eye on the key issues and identifying that it's the gaps in access to prompt treatment that persist in many endemic countries in the region that are fueling the continuation of this issue. And PAHO is urging countries to expand and ensure diagnostic services and treatment for malaria be a top priority. So with this in mind, we will look critically at the situation during the course of today's brief webinar. The theme for Malaria Day in the Americas for 2024 is expanding access to malaria diagnosis and treatment without barriers. And we will hear a presentation on that subject. In addition, 2 years ago in 2022, the Malaria Champions of the Americas Committee reimagined the process for the Malaria Champion selection. And this was done in close consultation with many countries of the region to make the process more sustainable. So today, champions will be recognized for the second year since we had made this shift. And as such, the candidates who will be evaluated this year have been those who showed progress since their prior 2023 submission until now. So we are excited to celebrate this year's selected champion, which will be revealed shortly during the course of the program. And then finally, key elements that support the expansion of access to malaria diagnostic and treatment services in the community are happening through colaboradores voluntarios, those community volunteers. And we will give this important group a very well-deserved tribute today. We will have a video that showcases their work, and we have the distinct honor that a few volunteers will join us today and respond to a few interview questions live. So with that, we thank you for joining in today's commemoration of Malaria Day in the Americas, and we wish to reiterate the commitment that this committee has to identifying and supporting the annual search for Malaria Champions in the Americas. Thank you, and back over to you, Pati.
Muchas gracias, Gabriel, por tus palabras.
Thank
Súper
you very much,
inspiradora y
Gabriel,
esperemos que
for your
llegue a todos
words.
en la región.
Very inspiring, and I
Con eso,
hope
now
they've reached
please
everyone in the
welcome
region.
Dr. Roberto
With this,
Montoya,
we welcome
Regional
Dr.
Malaria
Roberto Montoya.
Advisor of the Pan American Health Organization for a presentation on challenges in malaria elimination in the Americas, expansion of access to malaria diagnosis and treatment.
Gracias, Patricia.
Thank
Muchas
you,
gracias,
Patricia.
Gabriel.
Thank you very much, Gabriel. Also, every year, it is always a great pleasure to have this opportunity to communicate with all the partners and main stakeholders who fight against malaria in the region, mainly those people who are in the front line of the battle to eliminate malaria. So it is a great source of satisfaction to share with you the main challenges we have about elimination. And this occurs in the context of this initiative made by PAHO and promoted amongst member countries to eliminate 30 diseases. This initiative, Eliminate Communicable Diseases, is one of the main lines of action of the organization, and it is in this context that we've been working with the countries to achieve the elimination of malaria. The main topic today that we would like to promote is to expand access to malaria diagnosis and treatment for all, so that the affected communities do not have any barriers to accessing malarial treatment. So it's important to recognize, therefore, as Gabriel has explained the situation in which we are found. We have 505,000 cases in 2023 alone, based on what the countries have reported to the Pan American Health Organization. This represents an increase compared to the preceding year, and it highlights the challenges we have, particularly in the countries that bear the highest burden. If you look at the top side of this table, you'll see that countries are in color, and we see the subregions. And in gray, you see South America, specifically the Amazon area, where most of the malaria burden of the continent is located. Countries such as Brazil, Venezuela, Colombia report a high number of cases, as does Guyana. In the year 2024, there were partial figures, 35 to 37 weeks of the year. We've seen an increase in countries compared to the preceding year. However, on the other hand, in the lower part of the screen, you can see those countries that are reporting a lower number of cases after decades of combating malaria. These are their results. I would specifically like to highlight countries that are in green in Central America, where there are several that are very close to achieving total elimination, particularly Suriname, an Amazonic country that has been able to complete 3 years without any malarial transmission, which is a milestone in the history of malaria in our continent. It's the first time that a country in the Amazon area has achieved 3 years without any native malaria cases. And that is an example of that. It is possible. It is possible to eliminate malaria in the Amazon area. And it is possible to do it in a context where you have a difficult situation, populations that work mainly in gold mining and are mobile. So it is evidence that you can eliminate malaria with technology that has been available for many years. The rapid test, the diagnosis, the anti-malarial drugs, and it shows that when you implement them properly, you can interrupt transmission. So the significance of this milestone is huge, and it has allowed the country in a very short period of time to request certification from WHO. But there are other countries that are also attaining incredible goals that appear in the bottom part of the table. We are quite sure that they will be able to eliminate malaria in the next few years. Our continent is the one that has the most countries in this situation, and we will achieve the elimination. But let's go back to the high burden situation. It shows municipalities that have the highest level of transmission in Latin America. Here, you see the number of cases and also the number of persons that have been checked for malaria. And you see how in some cases, the percentage of positive cases are quite high. This is a demonstration that we have a great need to increase suspicion and detection of malaria. And the detection has to be done by the affected communities, like here, agricultural workers or indigenous populations, which in the Amazon and other contexts, like in the Mosquito area of Honduras and Nicaragua, there are people who migrate to the urban areas and set up in the outlying areas of the urban centers under difficult conditions. So they're a migrant population. Specifically in the Amazon area, these are gold miners. And thus we have to ask ourselves, if these Do these people have access to diagnosis of malaria? Do these people who live under these conditions have to go very far in order to be diagnosed and have their disease treated? Is this a diagnosis and treatment available on a daily basis? And is it permanent? That's why in PAHO we promote this main line of action to eliminate malaria, which is expanding access to diagnosis and treatment so that there are no barriers at any of the affected communities to benefit from this public good, which is the treatment for malaria. So these are the main elements. The diagnosis and treatment of malaria must be available in all health units in an endemic area. It's completely unacceptable for there to be health units or health workers in an endemic malaria area who cannot offer treatment for malaria when for more than 25 years rapid tests exist and there is very effective treatment which the ministries buy. So that's the first challenge in our region, because there are still some malaria programs where the diagnosis and treatment is offered only by the National Malaria Program, and it doesn't involve all health professionals, all health actors. Second element is to make sure the community participates, provide diagnosis and treatment with the involvement of the communities, because there are many areas and contexts where it's impossible to have access to a health infrastructure. It's not available to everyone. So with the tools that do exist, the community has a very important role in diagnosis and treatment and in ensuring that this becomes a public good. It's a public good only if it is really available to those people, to the areas where they're living, and they don't have to resort to long distances to receive treatment. So for this to take place, it's fundamental to use one of the tools that has existed for many years and in which there's still gaps in the countries in the region, which are the rapid tests. We cannot ignore the other skills that we have available in countries such as the microscopic analysis, but the rapid tests is effective and still needs to be more widespread. So the diagnosis and treatment should be in the hands of the communities and community actors who are linked to the system, who are supervised, who have been trained and continuously supported. And they can play a very important role in the communities so that people don't have to spend an hour going to a place where they can get diagnosis and treatment. That is the main factor in control and elimination. In 1964 to 2023, you see that we have achieved significant reduction beginning in 1994, but now we've reached a point where we haven't dropped further. We've gone back to where we were in 2015, and this makes us think that we have to do things in a different way. And to do things in a different way, we have to make changes. And one of the fundamental changes we have to make is to make that treatment and available without any barriers. One area of distance for these communities is enough reason for them not to get checked. On the left, you have control where communities have to go a long distance to arrive for diagnosis and treatment. On the right is what we're trying to show by what we mean by expansion. It's not what we've been doing for the last 30 years. Not at all. When PAHO talks about expanding treatment and diagnosis, we're talking about making it available in the communities without any barrier whatsoever, using existing technologies, and it's completely feasible. Very recently, we discussed this with the program chiefs of countries in the region in a meeting in Bogota, which was a significant milestone for us in this strategic guidance led by PAHO. These were the points that were highlighted as changes that are needed. And I put it in Portuguese on purpose so as to reach my colleagues and friends in Brazil. Changes are important. Diagnosis must be permanent, continuous in those communities. And we have to be more innovative supervise these networks, expand the networks. We need to understand what are the codes in the areas to organize a proper response. But behind of all of this is the right light column in gray. There has to be political commitment. That have to be changes to rules and regulations. New partnerships are crucial with different and new actors. For instance, all of the indigenous organizations and with the mining communities of both the legal and informal communities. There has to be a lot of communication because our countries have many different levels of decentralization, and it's important to have communication between the national, intermediate, and local communities. And there's a lot of room for improving this. PAHO works has been working on the technical notes that we've been disseminating to address this problem. And I would like to focus your attention on the center, which refers to another very fundamental point to eliminate malaria from our continent. And that is that we can accelerate the elimination of malaria in the Americas, but particularly falciparum. The numbers are very low in the Americas. They're very good. And we are sure that we can eliminate malaria by Plasmodium falciparum in the Amazons. And we have to do that before the people begin to develop resistance to that parasite, as is happening in Africa right now. So that's a fundamental issue where our approach has to be new. We have to increase access to diagnosis and treatment. And another important point in addressing malaria in migrant population that is traveling through the Andean area in Central America, we have to facilitate access and diagnosis to them so they can consult without any fear and can obtain the services. With this, I would like to again celebrate this day, this opportunity to be together, to acknowledge, as we will do today, the progress that has been made in expanding access to diagnosis and treatment. But also, my job is to present this as a challenge for all of us together to try to achieve this in the next few years and move towards the elimination of malaria in the region. Thank you very much, Patricia. Thank you, Roberto. Incredible that we've seen in our move towards eliminating malaria and trying to change efforts, policies, and increase the commitment by everyone in this battle. It's wonderful that you presented those strategies that can lead to facilitating access to malaria diagnosis and treatment in all these targeted areas, both at the health centers and facilities, as well as at the level of all the communities with the most affected populations that are hard to reach. Let me go back to English now.
In the last 15 years, the Malaria Champions of the Americas initiative recognized during the celebration of Malaria Day in the Americas, those actors at the national level or at the level of institutions or programs, at the level of the community that are working to sustain malaria elimination actions. Although, as Roberto has explained, we face important challenges, we also have successful experiences. We have good practices that can inspire other countries, decision makers, and other actors committed to the goal of eliminating malaria throughout the region. On behalf of the Steering Committee of the Malaria Champions of the Americas Initiative, I would like to invite Dr. Nirbhay Kumar, professor at the Milken Institute School of Public Health of the George Washington University, to present the 2024 Malaria Champions. Dr. Kumar, the floor is yours.
Hello and good afternoon. I've already been introduced by Patty, and I've had the distinct pleasure of serving as the chair of the Steering Committee of Malaria Champions of the America for a number of years. And the moment that we have all been waiting for, it is my distinct pleasure to recognize the 2024 Malaria Champions of the America. And this year, the committee has selected Huter, Norte region of Costa Rica, as the 2024 Malaria Champions of the Americas. And the citation, the recognition citation reads as, and I'll read that for you now. In recognition of the integrated efforts to guarantee access to prompt malaria diagnosis and treatment, successfully contributing to the steady decline in the number of malaria cases, predominantly Plasmodium falciparum transmission, Hutar Norte region has been a leader in the country for implementing, for the first time, the use of RDTs and having reactivated the call well strategy, that's a volunteer collaborative strategy to expand malaria diagnosis and treatment. Hutar Norte region is to be commended for these two milestones and for the efforts on improving malaria surveillance in health facilities, in the agricultural sector, and the localities with mining populations, all critical to reduce malaria transmission in two foci with agricultural and mining activities. So the committee was extremely pleased to see the progress, and on my personal behalf, as well as on behalf of the steering committee, I'd like to extend congratulations on this important achievement. Betty, over to you.
Felicitaciones a Costa Rica, región Huerta Norte. Los invitamos a saludar.
Congratulations to Costa Rica, to region Huerta Norte. We ask you to please turn on your camera so we can see you for at least a minute. Region Huerta Norte. The Huerta Norte of Costa Rica region has moved forward towards the elimination of malaria. In the last 5 years, the chiles and crucitas llano verde have been the main focus for malaria in the Huerta Norte region. And in these places, we've strengthened strategies to increase access to diagnosis and timely treatment, which has led towards the elimination of the autochthonous elimination of malaria. The region reduced local cases of malaria from 378 in 2022 to 128 in 2023, and only 8 cases have been reported in the epidemiological week 40 of 2024. This achievement has been attained through the implementation of 4 key strategies. One is passive surveillance in the health services. At the health services, the pre-consultation staff, triage, and external consultation staff are trained to identify people with fever or preceding fever. In this case, they do a rapid detection test for malaria for the purpose of detecting it quickly and early. 2, the volunteer collaborators. A total of 68 volunteer collaborators work in the 2 main foci of malaria, performing diagnostic tests in key sites such as farms and small shops to attain populations that are vulnerable populations. In 2023, we identified 12% of the cases, and in 2024, they identified 14% of the cases. This strategy with volunteer collaborators has strengthened passive determination and linked them with the social determinants for that community. 3, mass administration of medication. In 2023, they implemented mass use of medication in those communities where more than 80% of the cases were located. They were Medio Queso, San Gerardo, and Coquital, as well as in 2 farms. This strategy, together with reinforced surveillance, have kept these areas free of Plasmodium falciparum during 2024. 4th, active surveillance and passive surveillance in the mining and agricultural sector. We have deployed actions to have surveillance in pineapple, orange, and mining areas to allow for continuous monitoring and immediate care of cases at the work site. The heads of them and volunteers were trained to perform rapid tests on the workers before, if they have any kind of malaria symptom by guaranteeing a rapid and effective response. Thanks to the joint services of the health services, the volunteer collaborators, the community, and key stakeholders in the Ministry of Health and the Costa Rican Social Security, the region of Huerta Norte in Costa Rica has attained significant achievement in the elimination of malaria.
Excelente, excelente. Gracias.
Excellent,
Thank you, Dr.
excellent.
Kumar, for introducing us to the Malaria Champions of the Americas 2024. And huge congratulations to Huerta Norte Municipality of Costa Rica for this recognition this year. This has been an important step in the right direction toward eliminating malaria in the country and an important example that could be adapted in different settings. We are now heading to the third section of this afternoon event. PAHO has developed in 2023 and is actively promoting the expansion of access to diagnosis and treatment as the main strategy to achieve malaria elimination. For many key populations and those living in hard-to-reach areas, the collaboration of community agents makes it uniquely possible to implement this strategy in the communities. PAHO and the steering committee are poised to pay a well-deserved tribute to those community volunteers who, through the provision of malaria diagnosis and treatment, contribute to the malaria elimination efforts in the region. Today, PAHO is launching a 2024-2025 community volunteers campaign in this regard. First, let us watch a video showcasing the work of community volunteers in different settings in the Americas. Some in hard-to-reach areas, others from areas just lacking access to health services, but all helping to expand access to malaria diagnostic and treatment services to advance the malaria elimination goal in their areas. Let us watch the video.
Que os profissionais da SUCAM realizavam nesta localidade, eu me tornei voluntária no combate à malária, realizando os testes rápidos nesse setor. Eu fui minuciosamente treinada pelos profissionais da ação para realizar os testes neste setor. E hoje estou apta e muito feliz em poder ajudar os garimpeiros dessa região. É um trabalho muito importante, na qual os garimpeiros são beneficiados, porque tem a comodidade de ter um ponto de apoio na localidade onde trabalham. O teste é rápido, em apenas 15 minutos nós já temos um resultado, podendo diagnosticar o tipo de malária e assim cada paciente receber o tratamento adequado.
Mi función en Garimbo es dividir informaciones con los garimberos de cómo prevenir la malaria. También damos mosquiteros y entregamos malaquichi para los garimberos que van para garimbos muy distantes y siempre estamos haciendo los testes para evitar cualquier propagación de malaria.
During the process of the 2 days, we would have learned how to use the rapid test for malaria and also treatments. This kit is comprised of 3 different types of treatments, which is for falciparum malaria, vipox malaria, and a mixed infection. And we also have the rapid test here that will detect either it's a mixed infection, falciparum, or vipox. So with this initiative, it will be very grateful for the community, and it is expected to try to reduce the amount of cases in the Arakaca and to promote more healthy for malaria. Thank you.
Manejamos unos formatos en los cuales tenemos los formatos donde va donde ingresamos lo que son los pacientes que nos llegan, cuando nos sale positivo, la ficha que debemos de llenar.
Acuden conmigo niños y mujeres, hombres, fincas, bananeras y cañeras, entre otros. Es un trabajo en equipo con el personal de Victores, porque ellos me abastecen con los insumos de botiquín de malaria. Estoy muy orgullosa de pertenecer a la red de colaboradores.
Yanara malaria warkadaw gisna nahara ma dimri manikum ayal kuya kinya tasbayara upla balan riha tender munisna present gratis.
Desde el 2020 he venido realizando las pruebas de malaria, ya que no contamos con un centro de salud en nuestras comunidades, somos comunidades apartadas. He venido realizándolas a las personas afro-indígenas y extranjeras. Hoy doy gracias a Colbo por la certificación que me ha dado y he podido tener los insumos necesarios para atender lo que es la malaria.
Hasta el momento llevo 76 muestras tomadas y 28 han salido positivas. Bueno, para mí es un placer poder ayudar a esta población que por aquí todos somos agricultores. Entonces para mí es un placer poder ayudar porque de acá es muy disperso para salir al hospital o al pueblo a tomarse las muestras.
En este trabajo de 5 meses he sacado 128 pruebas y tengo 11 positivos y le he dado medicamento oportuno. Gracias colbol que tachiwa mi miendaite malaria pari.
Primero que todo le doy gracias a Dios por darme la oportunidad y luego a la comunidad. Me siento satisfecha porque la verdad nos hemos beneficiado toda la comunidad. Mi experiencia en el proceso que llevamos, he atendido falciparum, viva, mixto. O sea, me siento satisfecha porque le hemos entregado el tratamiento enseguida y no hemos tenido que trasladarlos hacia Valencia.
Muy agradecida porque la verdad antes me tocó de ir a Valencia muchas veces, cuánto me gasté de pasaje. Cada pasaje me costaba 100.000 pesos. Bueno, mis hijos se enfermaron con eso, los llevé de ella, pues le sacó la muestra y sí, me le dio una recomendación y gracias a Dios ellos están bien y pues me siento contenta.
Realmente son nuestros campeones de la malaria 2024, como siempre,
These are our
increíble
malaria champions for 2024. The work that they do and the manner in which they volunteer for their communities is unbelievable. The manner in which they provide these services to their neighbors and they help everyone towards this important objective of eliminating malaria in its entirety is a wonderful thing, and I believe it'll be something that will allow us to extend these services to everyone. With this, I'd like to now welcome Dr. Juan Carlos Espinal so that he can help us interview some of these malaria champions that have allowed us to be able to see a little bit more of what they're doing to contribute to malaria elimination. For this purpose, I would also ask the panelists that are joining us today to accept the request to be designated as panelists so that they can have access to their camera and microphone. The volunteer collaborators that will share their testimonials today come from Colombia and Costa Rica, two of the countries that are leading the way when it comes to the implementation of the volunteer collaborator strategy. As we've seen, the impact that they have had in their region in Huetar Norte in Costa Rica, which is recognized today as the malaria champion for 2024, we will also have a chance to meet the people that have been collaborating with us from Colombia, who has also made enormous strides in trying to reach out to most of the communities affected by malaria in that country. Colombia at the present time is trying to expand their training in order to have a larger number of volunteer collaborators in country that can support the malaria elimination strategy. Now, I'd like to invite the volunteer collaborators to open their microphones and cameras. I will list them by name. Marta Lucia Duave from Bochorama, on the Indian nation of Bochorama in Choco, Colombia. Ms. Diana Rendon from the municipality of Tumaco, Nariño in Colombia. Ms. Greta Arguello and Ms. Alba Suazo from Medio Queso in Coquital in Los Chiles, Costa Rica. Please, we ask all of you to open your cameras and your microphones so we can engage in this conversation with Dr. Espinal. Welcome to all of you.
Si se pueden introducir, por favor, para que el
Could you
doctor
please
Espinal las
introduce
conozca, sería
yourselves
genial.
so that Dr. Espinal can meet you? Welcome.
Hola, buenas tardes. Mi nombre es
Hello,
Gretel
good
Argüello,
afternoon. My name is
de
Gretel
Medio Queso,
Arguello
Chile,
from
Frontera
Medio
Norte.
Queso, Los Chiles, Frontera Norte. Hello, my name is Alba Loreto from the Coquital community.
Doctor Carlos, ¿tiene usted, Carlos?
Dr. Carlos,
Espinal, tiene usted
you
la
have
palabra.
the floor.
Creo que su micrófono está en
I
mute,
believe your
doctor
microphone
Carlos.
is muted, Dr. Espinal.
Sigue en mute.
You are still muted, sir.
Ahí ya está bien.
Is that working now?
Sí, doctor, siga, por
Yes,
favor.
yes, doctor. Please
Decía
continue.
que nos faltan
I was saying that
dos miembros
we are still
colaboradores
missing
voluntarios, ¿no?
2 volunteer collaborator members, correct?
Creo que estamos teniendo unos pequeños problemas de
I think we're
conectividad
having
personal.
some
Empezamos
connectivity
por nuestros
problems, but
colegas.
we can get started
Bueno,
perhaps with the colleagues that we do have on the call.
repetirme sus nombres de
Can you please repeat your names?
los dos que están allí, por
The
favor.
2 that introduced themselves, please.
Hola, mi nombre es
Hello,
Gretel Argüello,
my name
de
is
Medio Queso,
Gretel
Chile,
Arguello
Frontera
from Medio
Norte.
Quesos, Los Chiles, Frontera Norte. Hello, my name is Alba Suazo Robleto. I'm from the Coquital community and I work as a volunteer collaborator in that community
Bueno, muy bien.
in Costa Rica.
Alba
Very well.
Gretel,
Alba
muchas
and
gracias.
Gretel,
Yo quiero
thank you so much for
manifestarle
joining us.
en nombre de
I
todos
would
mis
like to
colegas
express on
nuestras
behalf of all of our
felicitaciones y
colleagues
nuestra
our
sincera
congratulations
admiración
and
por el
our
trabajo que
sincerest
ustedes hacen.
admiration
Es
for
un
the work
trabajo
that you do.
muy, muy importante
It is a
porque
very
está
important
ayudando mucho
job
en el
that you
control
do
y en la
that is
eliminación de la
helping
malaria.
enormously in
Entonces,
controlling and eliminating
empecemos
malaria.
con la señora
Let's
Alba
begin with
Suazo,
Alba
de la
Suazo
localidad de
from
Coquital,
the
¿no?
Coquital community.
Antes de la creación de su
Before
punto
the
de
creation
diagnóstico
of your
en la localidad de Coquital,
diagnosis
¿puede
unit in
contarnos
the
los
Coquital
desafíos a
community,
que
can you
se
tell us a little
enfrentaba la
bit about
comunidad
the
para
challenges
tener
that the
el
community
acceso al
was facing
diagnóstico y
in
al tratamiento de la
accessing
malaria?
diagnosis
¿Cuáles eran
and
esas
treatment services
dificultades
for
en el
malaria?
acceso
What were the
y en el
difficulties
diagnóstico?
involved in accessing the diagnosis and the treatment? Well, since we are a border community, we have a great deal of population mobilization. And for those of you who are not aware of the existence of the volunteer collaborator unit and the availability of services, for the general community, it is not widely known that these services are provided free of charge. And this is for people who are members of the Social Security system as well as migrants. And we try to address the issues related to malaria, and we try to provide information regarding the availability of services. So we try to come up with strategies using natural medications such as the hombre grande herbs, and in cases where the symptoms have been more severe, which increases the risk of greater propagation of the disease. And we've seen growth of the population accessing COBOL services in the communities. And we've been trying to do more awareness to make people aware of the availability of these tests. We have a number of colleagues that provide information to people so that they can create awareness and that they are made available to the community. And that's part of the strategy used by volunteers, collaborators. Many times we can conduct rapid testing that people who sometimes choose to have it in their home many times don't understand that the service is provided free of charge. Very well. Miss Gretel Arguello, what was it that drove you to become a volunteer collaborator in Los Quesos? And what is it that keeps you motivated today after 2 years of providing these services to your community?
Hola, hace más de 2
Hello.
años me encontraba
I've
en el EVAIS
more
trabajando como
than
oficial
2 years
de
ago,
seguridad,
I was
¿verdad?
working as a
Cuando escuché que
safety
necesitaban
officer,
un
and when I
colaborador
realized that they needed a
voluntario para la
collaborator,
toma
a
de
volunteer collaborator,
muestras,
to be able
de
to
una pensé, esta es
obtain
mi
samples,
oportunidad para
I thought
ofrecer
that
mi
this could be a
aporte
good
a la
opportunity for
comunidad,
me to contribute to
ya
my
que me encontraba
community,
estudiando para ser
given
acá.
that I was
Y me
in
serviría
school at the
mucho
time. And I
para
thought
ir
that this
adquiriendo
would be very helpful for me
conocimiento y
to acquire
experiencia.
knowledge and experience
Empecé muy
in this
motivada de aquí
field.
para allá
So
y se
I
los reto,
started
mi
my
comunidad
efforts
es de
with
muy
a great
escasos
deal of
recursos
motivation
y es
because in my
de muy
community,
difícil el acceso a los
we
centros de
have
salud.
very little in
Y
the way
pues
of
estando
resources,
como
and access to
colaboradora,
healthcare services is very limited.
haría más fácil
And
a ellos,
as a
¿verdad? El
volunteer
acceso de
collaborator, I
manera
could
rápida.
facilitate people's
En
access
lo
to
personal,
rapid
me
testing.
mantiene
For me
motivada.
personally, I
Para
stay
mí
motivated
es el compromiso que siento con mi
because
pueblo,
of the
ya que por
commitment
su
that I
amor,
feel
mi
with my
empatía
people.
y una buena educación
And I could
brindada a las
provide the
personas
empathy
van a
and
beneficiarse
education
del tener un
to
país
my
cerca
neighbors, and this will
donde se
allow
puedan
them
ir a
to
realizar la
access
prueba y
services
descubrir a
in
tiempo si están
locations that
con
are
la
much more
enfermedad y pues tomar
easily
las medidas necesarias
accessible.
para curarse.
And it also allows me to obtain
Muchas
samples
gracias.
in a timely way to be able to provide effective services to my patients. Thank you. Well, I wanted to ask a very important question to each one of the volunteer collaborators. The question is for each of you, and you can answer it in the order that you prefer. How do you feel about how the community receives services from you as volunteers without being a healthcare professional? What has been their reaction to the services that you offer, and how do they respond to you as the providers of those services? Well, I think I'll start. In my case, since I worked in 2022 with the Ministry of Health as a level 1 or tier 1 inspector, I was able to acquire knowledge and experience at that time. And I also would visit communities and I would do testing in those communities. So they started to see me around. They started to know more about me, get to know me. And now, as a volunteer collaborator, they have a great deal more trust in me. They feel much more comfortable when they show up to my house to get a test done. I believe that that's how I became widely accepted by my community. Same
Yo
question
como
for
era la
you.
oficial
Well,
de
since I was
seguridad en el
the
EVAIS, ¿verdad? Todo el mundo
safety
me conocía.
officer in my
Entonces,
municipality,
uno siente
everybody knew who
confianza
I
con
was.
la gente del
So over
pueblo,
time, I
es
was
más fácil
earning the trust
acercarse
of
a
all of
ellos.
my
Conocen
neighbors
y
in the
tienen
town. So
confianza y
it's
así
easier
pues
to approach somebody who
tomarles la
already knows
pregunta,
you, who
¿verdad?
trusts you. And when we offer the service, it's easier to make that happen. Well, very well. Thank you very much, Gretel and Alma, for your participation, for your wonderful contribution to helping your community, for your commitment to eliminating malaria. I hope to see you very soon on a different occasion. Congratulations, and I'm very happy that you're doing so well. Oh, look at that. We have Marta. Marta came in just at the right time. Marta, how are you? This is Carlos Espinal. I'm well, thank you. I'm here from Latigay. I come from an indigenous community here in Choco. Yes, it's also a community that has been gravely affected by malaria, Marta. We understand that. Please, Marta, can you tell us a little bit about the challenges that you've faced in trying to address this issue in the Motoma community, the indigenous community there? What sorts of challenges and difficulties that you face in trying to help people access diagnosis and treatment services? Well, we didn't have these level of training sessions. We do have malaria, but this year we started providing training to our communities. And since We are 4 communities in Cocho. Thanks to the training provided by Dr. Carlos Mario and the hospital director that provided training to us in order for us to be able to teach our communities what we needed. We have a great need in the community that wasn't being served, but thanks to this training through the Malaria Initiative, we've been able to get the training and the resources to help our communities to get tested in a timely way. In the community where we work, we now have these capabilities, and it makes me very happy to be able to provide this service, given that we didn't have it before. Excellent, Marta. I'm very happy that you are doing well and that you feel happy collaborating with the initiative to eliminate malaria through your volunteer service. I wanted to ask, what do you believe has been the reaction or the perception of the community with the service that you provide? Well, I think the community is extremely grateful for everything that I do because I am a person that collaborates and helps the community. And I believe that they are very grateful for everything that we do as a group. And they're very thankful for everything that we do in each municipality because previously these communities didn't have these services available. And as a result, they are very grateful for everything that we've tried to do for them. And we continue to work with them because this is still very helpful for the communities. And that's why we want to continue these programs, and we want to continue to keep working and treating patients. If we can continue to do this moving forward, once we overcome malaria, there are many other diseases that we can address. We have other communities that are undergoing many difficulties, and I'm extremely proud of the team that we've set up here because we're working extensively to help our neighbors. I really loved what you said about continuing the fight to eliminate malaria and extending it to other diseases. Once again, congratulations to all 3 of you. Thank you for everything that you do for your communities, for yourselves, and for all of us in the region. Your work is extremely valuable and very laudable. Thank you very much. Patricia, back to you. Thank you very much, Dr. Espinal, as you stated. Thank you very much to Alba, Diana, and Gretel for all of their efforts and for their dedication to their respective communities. We also wanted to thank all of the volunteer collaborators that are connected on this call and that are sending their own congratulations, and to everyone who has joined us today trying to move this cause forward, especially thanks to the invaluable collaboration and contribution of the volunteer collaborators.
The 2024-2025 Voluntary Collaborator Campaign. I would like to welcome Dr. Jan Seme Alexander for his presentation. Please, Jan Seme, take it from here.
Thank you, Patty. Good afternoon, everyone. Buenas tardes. ¿Pueden ver mi pantalla? No, todavía. Sí. ¿Pueden ver mi pantalla, por favor?
Sí.
Can you see my screen? Yes. Thank you. Good afternoon to everyone once again. Welcome to the celebration of Malaria Day in the Americas 2024. And with our issue of expanding access to diagnosis and treatment services without barriers. In this third part of the event today, we will be recognizing the excellent work being conducted by our volunteer collaborator network, as well as other community stakeholders in their communities to help us expand this access to treatment and diagnosis towards the elimination of malaria in the most expeditious manner possible. Let me see if I can move this forward. We are now in the third session of a campaign for recognizing all of those who participate in these efforts involving the diagnosis and treatment of malaria. and we are calling this campaign Faces and Voices, Malaria Diagnosis and Treatment. We are recognizing all of the participants in the expansion of these services towards the elimination of the disease. The objectives of the campaign include to inspire and motivate the work of people who participate in the diagnosis and treatment of malaria in communities, generate a space of specific technical information for these actors, and generate a space for recognition of all of those people that have made possible eliminating malaria in the Americas. The materials for the campaign Faces and Voices can be found on the PAHO website, where we will offer recognition to the community participation in diagnosis and treatment of malaria. We will recognize those who are working to eliminate malaria in the Americas, where they work and who they are working with through short videos, very much like the video we just saw today, where we will present all of the community stakeholders that are conducting these services. The campaign will also highlight short stories of community participation. We will also present success stories through reports, videos, maps, and networks. We will have resources available for all of the people that participate in these services of diagnosing and treating malaria in the communities. And we will have different elements such as infographics, technical information for community actors with rapid tests and training on how to identify suspicious cases for malaria. We will have Q&A as part of the Permanent Technical Forum, and we will have PAHO personnel supporting these efforts. We will also have a session on lessons learned that can be turned into practical orientations. Additionally, we will have a session on data and statistics on the contribution of community actors to malaria elimination. Additionally, we will develop guidelines to produce videos and stories from the community. The PAHO website, as I am showing you here on the screen, once you get on the website, you can see the available resources, namely materials regarding malaria. When we click on malaria, we can go into highlights, and there we will find the most up-to-date materials related to the issue of malaria. We have a WHO course for eliminating malaria, and all of this is linked to the Malaria Day in the Americas celebration. We also linked this to our webinar, press release that we issued to celebrate the Malaria Day in the Americas for this year. And soon we will have a space to ensure the recognition of community agents that support us in our struggle against malaria in those communities.
When you enter this window on recognizing COVOs, we will have material on this webinar, information on the malaria champions, short videos on the COVO activities and other community agents who have supported the effort to eliminate malaria, and successful stories. On the right-hand side, we will have resources such as guides for the use of videos, manual on PDR use for community agents, toolboxes. We'll have maps and networks telling the story of how we're moving towards elimination, and a Q&A section, as I mentioned earlier. And if, for instance, you click on the short videos, we can see one of all Coleman volunteer, his story, how he participated in eliminating malaria, and some information related to that situation. If we want to see where we're eliminated and who is doing this, you'll be able to see this on the web page, as so it appears here, which show you where the COVO is working, and where he's supporting these efforts. Who works to eliminate malaria? The faces and voices of the people who participate in that effort will appear. The campaign will organize semi-annual webinars aimed at community agents, and annually on Malaria Day of the Americas, they will recognize community actors who have contributed to eliminating malaria in the region, and they will promote recognition actions in the countries, the efforts being undertaken in those countries. In conclusion, I'd like to take the next 2 minutes to show you the timeline for the development of the next action plan, Malaria 2026-2030. We know that the current plan of action ends next year, and we will then initiate consultations with member states and other partners to work on and develop the new plan. The 2026-2030 action plan has to align with PAHO strategic plan 2026-2031, which is being developed. It'll offer some major ways of implementing the strategy and diagnosing and treatment in the Americas, and also steps to accelerate the elimination of falciparum in the Americas, all towards implementing the global strategies of PAHO and the initiative to eliminate all communicable diseases. We are thinking of a timeline that would have 4 phases to it. Be the conception phase in the first quarter, where the malaria team will organize consultations and discussions with member states and other partners to develop the zero draft of the plan. Then the second phase would be in the second quarter with an ad hoc committee to revise the first draft in consultation with countries. The third phase, which would take place between July and September, where we expect to consolidate the Malaria Plan of Action 2026-2030 so that it can be presented on Malaria Day in the Americas in 2025. And finally, they will present the product at the end of the year to the Strategic Advisory Group on Malaria at PAHO. It's now called ZAG, Strategic Advisory Group. So thank you very much for your attention and for seeing and paying attention to the timeline that we intend to participate in. And again, our congratulations to all the Colvilles who are supporting this effort to eliminate malaria, and to all community agents and all health staff. Congratulations, everyone. Thank you, Patty. Thank you very much, Jens May. It was a very exciting presentation, all the resources that will be available for the region, particularly the fact that we're going to be focusing on who are the ones behind this effort. We're going to recognize them, hear from them, and raise their profiles so that they can inspire others in the region to join this battle. With this, I'd like to call Dr. Montoya back, the PAHO's Regional Malaria Advisor, to say some closing words. Roberto, you have the floor. Thank you, Patricia. It's a pleasure to be here at the end of this celebration of Malaria Day and this recognition. As you said, this has recognized those people who are in the front line in battling against malaria in the region. And it's very satisfactory to see the recognition given to Costa Rica. And also for this opportunity to share directly and on video with people who are living in those communities and who are helping us eliminate malaria with such dedication to support their communities. I'd like to close by referring to 2 ideas that came up during this dialogue we had with the ministries of health and those people who are in charge of coordinating malaria programs and other key partners in fight against malaria in the region in September of this year. because when we devoted 3 days exclusively to discussing ideas on this challenge and how we would expand diagnosis and treatment, and we found how much is behind all of this, there were 2 points that struck me, and I'd like to conclude with them. And that's with, first of all, the thought that if we eliminate malaria, if we are able to achieve that and keep it at 0 cases, it was the general thinking that this was an action that could not only be accomplished by the ministries of health, it could not be done by them. It was felt that there had to be a real partnership, joint effort to work with the communities that were affected. And I would say even with society overall, and with all those actors that are living in those territories, like in the case of the agricultural workers or the gold miners. And by developing a partnership with these affected communities, say the indigenous communities and all the different organizations that exist in these communities with their own leaders, by establishing those kinds of partnerships at all levels, from the strategic, highest political level to the most local level, has been a great idea. I'd like to conclude with these 2 thoughts, that we firmly believe in this, and we are going to continue moving forward with this challenge of supporting member states in eliminating malaria, following the guidelines suggested by Dr. Jean-Alexandre. So again, without any further ado, we are very pleased at the Department on Communicable Diseases at the Pan American Health Organization that we were able to organize this celebration today and acknowledge those who are doing the work in the communities. Thank you very much. Thank you, Roberto. And again, congratulations once again to the region Huerta Norte of Costa Rica. And with this, I'd like to thank all of you for joining us today in continuing to work until we eliminate malaria. Thank you.